Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This spring, ACCC members joined a virtual working summit where they examined CAR T-cell therapy care coordination and patient and caregiver engagement and education. That summit was called Advancing CAR T-cell Care Continuity and Collaborative Patient Education. Our guest today co-chaired the summit and joins us to share its major takeaways. Amy Smith is the director of the Meredith and Jeannie Ray Cancer Center at the Ivinson Memorial Hospital in Laramie, Wyoming.
So with CAR T, patients have to have a caregiver with them the entire time, and they're expected to stay close to the academic center for 30 days post-CAR T. And it really sort of disrupts their lifestyle, right? And so in Wyoming especially, we have these old ranchers that really don't have anybody that can go with them. And so it limits the ability that we have to send our patients for CAR T when we can't do a lot of their care at home. And so the goal really was, how do we get those patients back here and get them back into some kind of normalcy in their life sooner? And a lot of that is building relationships and having trust with those providers in the academic centers that are performing the CAR T so that they know that we can provide safe care at home.
What was the goal of the Working Summit?
ACCC's Working Summit basically was to develop priorities and actions that will improve timely identification so that referral for CAR T patients happens early. But we also wanted to look at care continuity between those providers that were referring and where the referrals were going. So we wanted to look at the whole broad spectrum of treatment of patients with CAR T.
You were co-chair of the summit, but you also facilitated some small group discussions with participants. What were some of the things you heard in those smaller discussions?
Yeah, it was really interesting. I think we kind of went into this with a provider focus, at least on my part. As a provider and running a cancer center, I was kind of focused on that. But it was really eye-opening because we got to see a lot of different perspectives regarding patients and what their expectations were. And so in the small groups, I think it was interesting. We looked at patient needs versus expectations and how we would collaborate with those. We looked at provider needs and expectations. And then we also looked at ancillary staff support. So how do we support our teams and how do we grow to be able to refer early, get patients taken care of, and hopefully the goal is to really form a bond between the place that we're referring so that they have trust in the small centers so that patients can come home earlier and not have to be away from home for an extended amount of time. So keeping care close to home is near to my heart, living in a rural area. And so that was kind of the takeaways of it were really, how do we collaborate better to make this happen for patients and for teams?
What do you think are the key takeaways from the summit?
Yeah, I think one of the bigger things was how do we get training out to the smaller centers? And so developing relationships is huge, and being able to get training, whether that's from the drug companies, from different providers. The one thing that I heard in the summit was like disciplines. And so how do we have like disciplines training each other? And part of this, I can say, was kind of just an amazing thing that happened is I was able to connect with one of the nurse practitioners who cares for our patients getting CAR T in Denver. And we were able to develop this relationship. And looking forward, the thing that I see about this is that now I have a connection. And so within the summit, we talked a lot about how do we have nurses connect with nurses and providers connect with providers. And sometimes that can be really difficult.
Thank you, Amy. It's always a pleasure to have you on Cancer Buzz. You can head to the show notes to learn more about ACCC's Working Summit on Advancing CAR T-cell Care Continuity and Collaborative Patient Education. This episode was made possible with support by Kite Pharma, Johnson & Johnson, and Legend Biotech, and through partnerships with Cancer Support Community, Association of American Cancer Institutes, and Advanced Practitioner Society for Hematology and Oncology. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.